Okay, Dr. Heather Davediuk Gingrich is joining me today, and I am so excited to have this long anticipated conversation with you about complex trauma. Dr. Gingrich, thank you so much for joining me today. I really appreciate it.
It's my pleasure.
Yeah, that's
my pleasure.
Great. I know we've been planning this for a while, and I've been super excited about it. And this is a topic that I've really wanted to get into for some time. And I thought you were a really, really great person to bring on to talk about complex trauma. This is sort of, for me personally, also a very confusing area. So I would love to get into this discussion with you. Dr. Gingrich, can you talk about the work you do in complex trauma and what complex trauma actually is?
Okay, well, first of all, my primary job is as a teacher, a graduate school teacher, professor. So I taught undergraduate for a number of years in Canada, actually, in Kitchener, Ontario. So I'm excited to be talking to another Canadian today.
Absolutely.
Then my husband and I were missionaries in the Philippines for 8 years, where we taught in graduate master's level and doctoral level programs in counseling. And then we were recruited from there to teach at Denver Seminary in their master's level counseling program there. And just in the past year, we have moved to Northeast Georgia, of all places, and we are teaching at the graduate school at Toccoa Falls College. Now, that's a big change and a big move, but the reason for me that was exciting about this move is that I get to develop and coordinate a 5-course, 15-credit graduate certificate in trauma therapy. So rather than just teaching one course a semester or I get to teach 4. I have an adjunct teaching one of them, but developing the whole program. So I'm very excited about this opportunity to train people about trauma, area of specialization within the broader counseling field and within the trauma field. Not everyone who says they're a trauma specialist necessarily even knows much about complex trauma, because complex trauma really is connected more to relational trauma, often trauma in childhood, usually chronic, often sexual, emotional, physical, verbal, spiritual abuse. It can also sometimes refer to intimate partner violence victims, even if they haven't had any childhood trauma. Because intimate partner violence tends to be chronic, and it's also at the hand of someone who's supposed to be an ally, so someone who's supposed to protect and be a partner rather than being a perpetrator. And so that kind of trauma just has a different kind of impact on a person than other kinds of trauma do.
Okay, thank you very much. And sort of what kind of came to mind as you're speaking, Dr. Gingrich, would that apply as well to something such as a genocide, where perhaps it's not so much an external enemy that is committing the atrocities on you, but more of your own neighbors and village people that are committing the atrocities against you? I could imagine that would be an example of that as well.
Sure, because it's relational in nature, and again, it has that betrayal element, which is different than, most wars are fought against an enemy.
Right.
And so that while soldiers and veterans can still have, kind of moral injury, where actually killing another human being really can be traumatizing for them. For the most part, you kind of know that you're in war and this is an enemy. This isn't someone, it's not a betrayal. This is not someone who's supposed to keep you safe. This is the enemy. So it's, even though you're being shot at or bombed or whatever by another person. There's no expectation that that person is there to protect you. Um, Whereas, even in a genocide, it's people's, neighbors, even friends,
Mhm.
people that have been known for a long time that
Mhm.
that are turning around and perpetrating against you, even killing you and your family and friends.
Okay, that makes so much sense. And is this a common situation as well, where this is developed because a child has a parent or a primary caregiver who has a severe personality disorder, such as narcissistic personality disorder?
Oh, sure.
Yeah.
There are some perpetrators that are intentionally going out to hurt children, or
Mhm.
else they're just worried about their own needs and end up hurting children. And that's where something like a narcissistic parent, or
Right,
even a parent with a, a mental disorder who isn't trying to hurt their child,
right.
um, but isn't protecting their child, isn't caring for them adequately. So neglect, emotional and physical neglect, can also fit under the label of complex trauma. Or an alcoholic home, even where there's no physical abuse, generally there is some kind of neglect. Often there's verbal abuse or emotional abuse that's just part of having a parent that's not in a position to properly care for a child and may outrightly abuse them. So um, you know there are people who had parents who loved them, but who are in situations, or just struggling with mental illness or other disorders themselves, where they ended up doing doing some damage to their children without necessarily intending to.
Okay, and is there in terms of outlook, does that ever make a difference in terms of the damage done and the outlook, or not really? It doesn't, intent maybe doesn't matter too much in terms of the damage done.
Yeah, I mean, children make up their own explanations for what happens to them.
Right,
So all they know is that their needs aren't being met, or they're being
right.
hurt in some ways. Uh, Generally, children blame themselves. They don't blame their parent or their pastor or their coach, or whoever else is perpetrating against them. They think that something's wrong with them. So in the terms of an alcoholic family, if mom or dad is drinking too much, the child generally thinks it's because of something that they have done, or if they were a better kid, mom would have to drink, or they'd be able to somehow get them help.
Mhm.
Um, so often that's part of the damage, right? Is what it does to the child's sense of identity and self. Now, in the healing process,
Mhm.
it might make a difference.
Right,
As an adult who's been harmed as a child, has some perspective that, hey, my parents weren't out to harm me. They
right.
were dealing with their own issues, their own stuff. So I ended up being harmed as a result, but it wasn't intentional. That can make a difference compared to a child who knows that their stepfather sexually molested them
Mhm.
chronically for years, or physically, or the mother physically abused them over and over again in ways that could not just be labeled normal discipline. So I think coming to grips with what was happening might be a little easier in some circumstances than others, because that meaning making is part of what happens as someone is in a recovery process themselves from from such hurts and abuse.
Okay. Thank you. Thank you. A question I have, Dr. Gingrich, and it's probably a huge question, actually. It's very confusing to me. And I've heard a lot of different people tell me the same thing. Now, is this please clarify this for me. So first of all, complex PTSD is not in the diagnostic and statistical manual. It's not an actual diagnostic term as of yet. And the second aspect to that question is it being misdiagnosed or perhaps accurately diagnosed, I'm not sure, as borderline personality disorder? That seems to be a huge issue, debate, problem. And then something I'm hearing a lot about is, as a result of that, there are these groups going on, say support groups or therapy groups, and you're having people with potentially serious PTSD in a group, a therapy group, with people who have potentially malignant personality disorder issues, and there can be some real problems with that. Do you have any thoughts on that? What is going on with those labels, maybe?
Well, first of all, to the DSM issue, unfortunately, it isn't in the DSM as an official diagnosis. And that's problematic because for some mental health professionals, if it isn't in the DSM, it doesn't exist.
Right.
But we know, and research shows that there are differences between PTSD and complex PTSD.
Right.
Those of us, my colleagues and I that are in this field, were very, very disappointed that this diagnostic category didn't make it into the DSM, because that means that a lot of people aren't getting the help that they need, and that they are being given other labels. Now the one diagnostic category that could fit people who are victims of complex PTSD is PTSD with a dissociative subtype. And that is something new in the DSM-5. And that is for someone who exhibits some dissociative symptoms such as depersonalization or derealization. That means derealization is when other people or the world kind of outside their surroundings look kind of strange or unfamiliar. Depersonalization is when perception of self seems either kind of disconnected or seems strange in some way. And because a lot of survivors of complex trauma experience those symptoms, that does at least help them to be seen as in a slightly different category. So maybe able to get slightly different treatment than someone who's just diagnosed with PTSD. But I think it also misses a whole lot of people. Now, when it comes to something like groups for someone, say, with personality disorders,
Right.
I mean, there can be comorbid diagnosis. So it is possible for someone, a lot of people who have personality disorders actually are survivors of complex trauma.
Right.
But usually in those groups, the trauma isn't acknowledged. People aren't being treated for the trauma. They're being treated for other kinds of symptoms. And sometimes that can be helpful, say, DBT groups, dialectical behavior therapy groups, are common groups for people who have been given a diagnosis of borderline personality disorder. Well, DBT can be very helpful with some of the kind of regulating emotion and helping people to make good choices day by day. And that can be helpful for a lot of trauma survivors as well. The thing is that that just deals with the kind of most obvious symptoms. And if the trauma isn't acknowledged, then nothing ultimately changes. Because unfortunately, something like the borderline personality disorder gets labeled as something that's unchangeable. This is something that someone has for their entire life. And while it is a personality style that can be difficult to change, if it is trauma based, once the trauma roots are looked at and processed, then it can change. and that's the same for, often people get mislabeled as having bipolar disorder when it's actually, the mood swings are actually more connected to trauma, or very often other diagnostic categories fit. Depressive disorders, anxiety disorders, I think often have a trauma base that's overlooked.
Interesting, interesting. That's and so how then, because the so for somebody who has complex PTSD issues, how do they go about finding a competent psychologist or psychiatrist or clinician that understands this without them being further re-traumatized, diagnosed with something else, and the situation getting worse? Do you have any advice or resources for people, because that's a huge issue, I think.
Sure. I think
Thank
what I
you.
have is questions that I would ask,
Okay.
that I would tell someone seeking a therapist to
Okay.
ask. And the one question would be, what training do you have in treating complex PTSD or complex trauma? And if they seem to ignore the complex part of that and just say, well, I'm trained in treating PTSD, and they don't go on to talk about complex PTSD, that would be a warning sign for me. That would be a red flag to kind of, so I'd go back to that and go, okay, I hear that you use EMDR, um, or exposure therapy or prolonged exposure therapy. But do you use any other treatments for those who have complex PTSD? And if someone doesn't have a good answer for that, or they just say, "Oh, EMDR or this is good for any kind of trauma," then then to me, I'd look for somebody else, um, because this person obviously doesn't know enough to even respond to those questions. Another question might be, um, do you hold to a phased treatment model for complex PTSD? Because a phased treatment is kind of the standard um, protocol, kind of the gold standard for working with complex PTSD. And basically, what that involves is phase one, where the focus is on stabilization and symptom kind of management, safety, development of safety. And so that doesn't go into the trauma at all, except in kind of an overview type of way. You're not trying to do any trauma processing during phase one. And phase one can last months or even years for some complex trauma survivors. If you think about it, complex trauma is the result of trauma at the hand of someone that is supposed to be trustworthy. So it's going to take a long time for someone who's a complex trauma survivor to trust their counselor. And
Yeah.
so to go into trauma processing, which can be very destabilizing with someone you don't know if you can trust yet, is a huge mistake. And to go into, so that's phase two, is the actual trauma processing. But if someone doesn't have coping mechanisms, ways of of managing emotions when their nervous system gets hyper aroused, they shouldn't be doing trauma processing, because that can just make things worse. And then the phase three is kind of learning how to live life as, a whole human being, and how does that look different than how do relationships look different? How can you, live and make decisions differently? So if someone isn't familiar, if a counselor um, isn't um, able to talk about a phased approach, then it means you shouldn't go to you shouldn't go to them. And if someone is able to say, "Oh yes, well, in a phased approach, it starts off with safety and symptom stabilization. We don't process trauma until later." Okay, that's a really good sign. That's okay. This person understands that I'm not just to go into trauma processing right away. If someone just talks about EMDR, then that's a big red flag. I'm trained in EMDR. I think it can be very helpful for a lot of trauma survivors, but for complex PTSD, special protocols, adapted protocols are necessary. Um, and um, and someone has to be able to use adapted protocols within a broader framework of phase treatment. If they don't do that, EMDR could potentially do more harm than it can do good. So those would be a couple of things I would look for. That someone seems to have a broader perspective on trauma. They don't just talk about EMDR. If they do, they talk about it needing to be modified for
Right.
complex trauma, that they know what phase treatment is, and that they don't just talk about cognitive behavioral approaches or exposure therapy, which can be wonderful treatments for PTSD that isn't complex, but aren't enough for complex PTSD.
Okay.
Another thing I'd say is that there is an organization that I love. It's called the International Society for the Study of Trauma and Dissociation. That is an organization that's been around for decades, and it basically specializes in training therapists on how to treat complex PTSD and dissociative disorders. So if you go to the Find a Therapist, tab on their website, anyone that's listed there is going to know something about complex trauma. It doesn't mean that everyone has equal training,
Right.
but if they're listed there, if they're a member of ISSTD, it means that they've been exposed to treatment modalities and so on that are going to be different. So that could be a place to start.
Wonderful, thank you. And just sort of two questions that I got as you were talking there. Something I've been asked about before a number of times, and I think that speaks to the safety element and the trust element that you're talking about. But I'm sure I don't have to tell you that with flashbacks, sometimes there can be violent rages, violent urges, violent thoughts, shameful thoughts to the person. And they have these thoughts, they have not acted on them per se, maybe they've thrown dishes around or whatever, they've had some rages, and they're scared that if they share that with somebody, the next thing you know, the police are going to be at the door taking the kids away, even though they haven't touched them. There's a fear there that, how can I get treatment for this if I feel like I can't express some of the things that I'm going through, or the violent urges I'm having that I'm not acting on, but I'm afraid of. Can you speak to that a little bit, Dr. Gingrich?
Well, it is true that there are reporting laws in, Ontario provinces and states of the US that if there is suspected child abuse, then a mental health professional is legally required to report
Yes.
it. But that doesn't apply to, I mean, the only way urges would be reportable is if the client actually stated, I have hurt a child in this way.
Okay.
Being concerned about feeling angry and what's actually been the behavior that's resulted from that are two very different things.
Okay.
So no therapist I know of is going to, Child Protective Services, whatever they're called in any particular province or state, are much too busy to kind of spend their time on someone who talks about feeling angry, very angry at times, unless there is evidence that a child actually has been hurt or is in immediate danger.
Okay. That's I think that's thank you, because I think that's it's sort of an irrational, but like I totally get why people are concerned about wanting to express, and a lot of the times it's not at the child or at the spouse. It's like, oh my gosh, this coworker really did me wrong, and I just have these urges, and I don't want to express them because they might think I might go postal or something like that. So thank you for clearing that up, Dr. Gingrich. And then a question on that note as well. If there's a therapist watching this, or a coach, a clinician who is very interested in this subject and would like to help people with this, but they don't know where to start. Is your book, Restoring the Shattered Self, a good place to start? Is that still available? Okay, perfect. Is that still available
Oh, yes, it
for
is.
purchase?
This
Okay,
just came out in
wonderful.
its second edition.
Wonderful.
In 2020. There was a first edition in 2013. So yeah, I think it's a really good place to begin.
Mhm.
I wrote the book trying to avoid a lot of, trying to make it not sound like a technical textbook, because I know that a clinician at the end of a really busy day often doesn't want to pick up a heavy duty textbook. You're too drained. So this is written in a more conversational style,
Mhm.
but has the content that really talks about treatment um, and what can be helpful. So that would be one place to start. Um, Another place is to get some more specific training on trauma. So like the trauma certificate that I've developed for that very reason, is recognizing that often counselors don't get adequate training or education about trauma. If they get a course at all, in their master's program, it's usually a course in crisis and disaster. Very seldom does someone get a course in complex trauma.
Right.
And so I agreed to develop this program specifically so people, whether they're students or already clinicians, but just realize there's a gap, that they can learn about how to treat different types of trauma and how complex trauma is different from simple trauma. And so we get between, you know, within all five of those courses, people get a really good idea of how to treat different types of trauma. And it's asynchronous online, so it means people from all over the world can take it. There are no actual classes, not even Zoom classes. There are times where people have to meet in small groups, but if they do, they they come up with a time that suits them. So people in very different time zones can study. Um, so while, I prefer residential in many ways, the reason I agreed to teach it in this format is that I feel as though it's accessible to more people, and I want more people to get trained. Other options are the organization I mentioned to you, the International Society for the Study of Trauma and Dissociation,
Mhm.
teaches courses in both beginning, intermediate, and advanced levels in complex trauma, and then separate courses in dissociative disorders, such as dissociative identity disorder. And they also have specialized courses for the treatment of children and adolescents. So there is lots, as well as having all kinds of webinars. Their conferences are amazing, their annual conferences, and they have online conferences as well as in person now that COVID is
Mhm.
over, at least as a pandemic.
Mhm.
Um, so that's I would definitely suggest that people check out the resources in ISSTD and take out membership, join some of their special interest groups, which are special interest groups according to specific populations within the broad rubric of trauma and dissociation.
Wonderful. I think it's so great that you're offering. That was going to be my next question, is if they're available online, because I think that's fantastic that you're offering an entire program in complex trauma. And um, sort of before we wrap up here, Dr. Gingrich, would do you offer, or would it be beneficial? I don't know if anyone exists out there. Is there couples counseling, marriage counseling, family counseling for this type of for for this type of issue? Or trauma,
That's
complex
pretty
trauma informed?
specialized.
Right, that's what I kind of
There,
thought.
there are people out there. In fact, my husband and I co-edited another trauma book called Treating Trauma in Christian Counseling. So it's more academic-y, it reads like an edited book on
Right.
all kinds of trauma. One of the chapters in that book is treating um, treating trauma and treating complex trauma within couples therapy.
Okay.
And there's another chapter on kind of family resilience, and developing family resilience. So someone who's interested kind of more in a couples, family kind of systemic approach, that might be a good place to start.
Wonderful.
We also do at Toccoa Falls College here. All the graduate programs are asynchronous online, and my husband directs the marriage and family therapy program. And because he's married to me, who's a trauma specialist, he inserts things about trauma in all of marriage and family courses, and marriage and family people have the option of adding some of the courses in the trauma certificate, to their degree, or getting a certificate as well as an MA in marriage and family therapy. So those are other options as well.
Wonderful. And which website is the trauma certificate? Where can I send people to have a look at your certificate?
Just do a search for Toccoa Falls College.
Okay.
So TOCCOA
Mhm.
Falls College, and go to their graduate programs, or even just do a search for Toccoa Falls College Trauma Certificate, and the website will come up about the trauma certificate, about the other, the MA marriage and family therapy, as well as we have an MA in counseling ministries for more like church-based people who don't necessarily need a license, but want to be more informed about counseling, and that can be combined with the trauma certificate for just an additional course as well. So some people might be interested in that. I also should mention, Tegan, that
Please.
for the trauma certificate, someone doesn't have to have any background in counseling or psychology. They just have to have an undergrad degree.
Okay.
So if you have listeners that are just interested in the area, or interested in kind of helping people, or just being more informed, that can also be an option for them, even if they have no plans to become a professional counselor.
Right. Right. Okay. Perfect. Thank you so much. That's wonderful. And thank you. As I said, I'll say goodbye to you after this, Dr. Gingrich, but thank you so much for taking the time to have this conversation with me today. It's I think what you're doing is tremendous. I don't think there's enough help and information out there, and I was just really excited to have you on today. And can people find you? Are you on social media at all, or do you kind of stay away from that? I'm going to link to your your faculty website and your book, of course.
Yeah, probably the easiest way is to email me. I have a website, but it hasn't had much attention because it has to be updated, and I've been a little paralyzed, to tell you the truth. So if any of your listeners know a good website builder, or want to contribute to what I do by helping with my website, I would appreciate that. So email is the best way to reach me. I also, can I say one more thing that
Absolutely.
I'm excited about?
Please do.
I have a book. I have a book contract for the general public for survivors, and we haven't decided on the subtitle yet, but the title is going to be Shattered No More, and it's the release date is going to be April 15th, 2024. I am 3/4 of the way through writing it. It has been in process it's taken me 9 years to find a publisher who actually believed that this book needed to be written. Other publishers told me there's too narrow an audience, and statistics didn't seem to convince them that there is so much abuse out there. There is so much complex trauma. There will be lots of people who will benefit from this book. And so I finally found someone who has the same vision I do. The publisher will be the American Association of Christian Counselors. So you can recommend any counselors out there to your clients.
Absolutely.
And it should be out, in April. So look for it then.
That's
Shattered No More.
Really exciting. Congratulations. I'm really excited to look out for that release. That's very exciting. Thank you so much, Dr. Gingrich, for your time today. It was a very exciting conversation. Yeah, thank you so much for everything that you do.
You're welcome. Thank you.